The association between disabled people and ill health. Where has it come from? Hello people, I hope you're all keeping well, keeping safe and keeping your distance. My name is Ben Andrews, I'm an expert in inclusion for disabled people and this channel is dedicated to just that. If you're into this type of content, make sure you hit that subscribe button and ring that bell. In my last video, I explored the misguided belief that disabled people are inherently ill and the negative impact this has on disabled people's ability to be healthy. So in this video, I thought it'd be useful to explore where this belief might have come from. So with that being said, let's get into it. There's an ingrained belief that disabled people are inherently ill. This impacts people's ability to practice and attain good health and is at the core of many of the health inequalities that disabled people experience. While largely misguided, unhelpful and untrue, if we take a look at our history, it's not difficult to see where this belief has come from. As far back as ancient Greece, it was declared that those born puny and ill-shaped were to be disposed of, leading to the mass infanticide of disabled children. In the New Testament, disabled people are portrayed as the beneficiaries of miracles to be cured of their sickness or impairment, or completely segregated from society for fear of contagion. This was also part of the logic in more recent times, with disabled people forcefully confined to mass institutions, submit to inhumane procedures and conditions as a means of treatment, as well as being perceived as burdens and murdered as life not worthy of life. So, if we look at our history, we've not really been exposed to much else other than disabled people being perceived as ill, in need of a cure, with very little value placed on their lives. And while we might like to think time has moved on since biblical, unethical and pseudo-science-based beliefs, years of conditioning doesn't disappear overnight. Today it manifests into disabled people being less likely to be resuscitated in hospitals, large resource going to a search for cures rather than improving access, and most relevant to this piece, terms like sick, ill and unwell are used interchangeably to describe disabled people. And while some people who associate with these terms might be disabled, they are not appropriate or reflective descriptions for all disabled people. These terms are used to describe ill health, and directly associating them with all disabled people infers some kind of inherent illness or inability to be healthy. While you might think this is just terminology, this terminology stems from our current belief system, which at this time doesn't support and in some respects allow disabled people to be healthy. Now we can't change our past, but understanding it does allow us to rationalise our actions and thinking in the present. From there we can make an informed choice as whether we want to continue dated beliefs which are only serving to reduce how well and long people live, or acknowledge these beliefs for what they are and work to make healthy lives possible for everyone. Thanks for listening, I hope you enjoyed this video. If so, please do like, share and comment below. I'd love to hear whether you think our past has any impact on disabled people's ability to be healthy in the present and what you think needs to change to support healthy lifestyles for all in the future. And on that, I hope you all keep well, keep safe, keep your distance, and until next time, take care.